Hello everyone. In this video, I will be sharing and reviewing 5 top 200 drugs: atorvastatin, levothyroxine, metformin, lisinopril, amlodipine. Atorvastatin, brand name LIPITOR. This medication was approved by the US FDA in 1996, which is almost 30 years ago, and indicated for the treatment of heterozygous or homozygous familial hypercholesterolemia, as well as for the prevention of atherosclerotic cardiovascular disease. The recommended dosing for this medication start dose 10 or 20 milligram oral every 24 hours. The dosing range for this medication is 10 milligram to 80 milligram every 24 hours. If we look at the drug chemistry, this is a small molecule synthetic lipid-lowering statin agent. This belongs to a member of type 2 statin class synthetic agents. If we look at the drug structure, there is a pure heterocyclic core motif in the middle. This medication drug molecule also contains the parafluorine phenol motif, and this is important moiety. It's available in all the synthetic statin class, the parafluorine phenol motif. So plays an important role in interacting with the target's HMG-CoA reductase. So in addition, this is a acidic drug molecule, contains the carboxylic acid. So therefore this medication is available as a salt form. So there are 2 drug molecules and then have this calcium ion. So that's the salt form, along with trihydrates. The molecular weight for this medication 558.64 gram per mole, hydrogen bond acceptor 7. So hydrogen bond acceptor refers to the number of hydrogen and oxygen within the drug molecule. Hydrogen bond donor is 4. Hydrogen bond donor refers to the number of hydroxy and NH groups within the drug molecule. Log P is 3.85. So it's pretty lipophilic drug molecule. Polar surface area is 112 square angstrom. Mechanistically, this medication works as a selective competitive HMG-CoA reductase inhibitor by targeting a rate-limiting step and also an early stage in the hepatic biosynthetic pathway of cholesterol. So therefore, by blocking this enzyme HMG-CoA reductase, so this would decrease the production of the cholesterol. Pharmacokinetics: absorption rapid, volume of distribution, so it's around 381 liter. Protein binding, it's more than and equal to 98%. Metabolism, so this medication is metabolized by CYP3A4 enzyme. Bioavailability, it's around 14% or 30%. Tmax, so that's the time to reach the maximal drug concentration in the blood. It's 1 to 2 hours. Half-life, 14 hours for the parent drug molecule, 20 to 30 hours for the metabolites. And the metabolites is also active, equal potent. Excretion in the bile and urine. Drug-drug interactions may increase the risk of myopathy and rhabdomyolysis of LIPITOR. For example, the CYP3A4 and or transporter inhibitors. So for example, the immunosuppressants cyclosporine, And because this agent is CYP3/4 and the transporter inhibitor, so therefore this can increase the drug exposure for LIPITOR, along with some other antiviral protease inhibitors, and avoids atorvastatin. In some other cases, for example, the macrolide antibiotics, clarithromycin, azole and fungos, itraconazole, for example, and select antiviral protease inhibitors, make sure do not exceed 20 or 40 milligram atorvastatin daily. Please refer to the prescribing information for details. The adverse effects: nasopharyngitis, pain in extremity, arthralgia, so that's the joint pain, diarrhea, and urinary tract infections. Levothyroxine, the brand name SYNTHROID. This medication was initially approved by the US FDA in 2002 and indicated for the treatment for hypothyroidism as a replacement therapy and pituitary thyrotropin stimulating hormone TSH suppression. This is a synthetic form T4 of endogenous thyroxine hormone, and gastric acidity favors levothyroxine absorption, so which means the more acidic environments will help the levothyroxine absorption. In terms of dosing and administration, starting dose for this medication varies. Taking orally once daily, preferably on an empty stomach, 30 minutes to 1 hour before breakfast. This medication carries a US box warning, not for the treatment for obesity or for weight loss. So if we look at the drug structure, so levothyroxine, as mentioned earlier, this is also referred to T4. T4 because there are 4 adenines within the drug molecule. So there are 2 adenines in the outer ring and there are 2 adenines in the inner ring within the drug molecule. Molecular weight is 776.87 gram per mole, 100 bond acceptor, 5 100 bond donor, 4 log P, 4.72. So it's pretty high lipophilic because there are 4 adenines within the drug molecule. Polar surface area, 92.8 square angstrom. Mechanistically, T4 is converted to the active T3 form via deiodination in peripheral tissues to exert its physiological effects. Because this is a T4 there, and the active form, that's the T3. So the T3 basically will, by removing one adenine from the outer ring. So therefore that's the process converting from the T4 to T3. If we look at the pharmacokinetic profile, absorption ranging from 40 to 80%. Onset takes a few days, 3 to 5 days. Protein binding is over 99%. Metabolism, as mentioned, and this drug molecule T4 will be converted to T3, that's the active form, by removing one adenine from the drug molecule. Also, so this drug molecule can be metabolized to reverse T3, so that's by removing one adenine from one inner ring. So therefore, that's the reverse T3 metabolites. In addition, this can be converted to T2 drug molecule as well. Tmax, that's the time to reach the maximal drug concentration in the blood, and it's ranging from 2 to 4 hours. Half-life, it's 6 to 7 days. Excretion, feces, around 20%. Urine, so that's the major excretion route. Drug-drug interactions, phosphate binders, metal supplements. So for example, the calcium carbonates, iron sulfates, bile acid sequestrations, and ion exchange resins. Because all these agents we just mentioned may bind to levothyroxine, so therefore this would lower its absorption. So therefore we have to space out this medication at least 4 hours apart due to this lowered absorption reason. So in addition, as mentioned earlier, gastric acidity favors levothyroxine absorption. So therefore, patients, if they take a PPI, for example, the proton pump inhibitor or antacid, this would lower the absorption for levothyroxine. In addition, the beta blockers and glucocorticoids, this may decrease the conversion from T4 to T3. So that's all the drug-drug interactions. The adverse effects are primarily from hyperthyroidism, so due to the therapeutic overdose. Metformin, the brand name, that's RIOMET. This medication was approved by the US FDA in December 1994 and indicated as an adjunct to diet and exercise to improve glycemic control in adults and pediatric patients aged 10 years and older with type 2 diabetes mellitus. Recommended dosing for this medication, adult dosing starting 500 milligram oral twice daily or 850 milligram once a day with meals. Increase the dose in increments of 500 milligram weekly or 850 milligram every 2 weeks up to maximum dose. So that's the 2,550 milligram daily, given in divided doses. Doses above 2,000 milligram may be better tolerated if given 3 times a day with meals. This medication carries a US box warning, lactic acidosis. If we look at the drug structure, so this medication that's a dimethyl and also have 2 guanidine motif within the drug molecule. So therefore, this is a member for biguanide, the metformin. So that's the member for biguanide drug class. Molecular weight, it's 129.16 gram per mole, hydrogen bond acceptor 5, hydrogen bond donor 5, log P is negative 1.25. Polar surface area 89 square angstrom. As mentioned, this is drug molecule contains 2 guanide motif, biguanide, so therefore this is a very basic drug molecule. The pKa for this drug molecule is 12.4. Yeah, so it's a pretty basic. In addition, this product is available as the salt form with the hydrochloric acid, the salt form. Mechanistically, this medication works to lower hepatic glucose production, decrease intestinal absorption of glucose, and increase insulin sensitivity, increase the peripheral glucose uptake and utilization. So basically, you can see this medication works in several ways. Pharmacokinetically, bioavailability ranging from 50 to 60%, volume of distribution, so 654 liter, protein binding, negligible, metabolism, not really metabolized, this medication. Tmax range from 2 to 3 hours, half-life 6.2 hours. Excretion, urine 90% as a parent drug molecule. So basically this is a very polar basic drug molecule. So you can see predominantly excreted in the urine as a parent drug molecule. So therefore we have to be mindful for patients if they have impaired renal function, so have to adjust the dosing accordingly. Drug-drug interactions, carbonic anhydrase inhibitors may increase the risk of lactic acidosis. Drugs reducing metformin clearance may increase accumulation of metformin. In addition, alcohol can potentiate the effects of metformin on lactic metabolism. Contraindications, severe renal impairment, for example, eGFR less than 30, hypersensitivity to metformin, acute or chronic metabolic acidosis, including diabetic ketoacidosis. So all these medical conditions, you can see they are contraindicated. Adverse effects. The most common adverse effects, so they are pretty much GI related. So for example, diarrhea, nausea, vomiting, flatulence, asthenia, that's the lack of energy, and asthenia, indigestion, abdominal discomfort, headache. The next medication, lisinopril. The brand name, ZESTRIL, QBRELIS. This medication was initially approved by the US FDA in 1987, indicated for the treatment of hypertension in adults and pediatric patients aged 6 years and older, or acute myocardial infarction, adjunct therapy for heart failure. If we look at the dosing administration, this medication is available as tablets and oral solution available. Initiates 2.5 to 5 milligram for heart failure or the myocardial infarction, 5 to 10 milligrams for hypertension, taken orally once daily. Increase the dose to 40 milligrams daily as needed and tolerated. Adjust the dose for patients with impaired renal function. If we look at the drug chemistry, this is a small molecule. You can see lisinopril have 2 basic primary amine along with the secondary amine motif. And this drug molecule also contains 2 carboxylic acid. So therefore, this is not the prodrug, not like the other ACE inhibitors. All this, again, want to emphasize is the lisinopril ending with the pril. So that's the suffix for the ACE inhibitors. Pretty much all the ACE inhibitors, right, ending with pril. The molecule weight is 405.49 gram per mole. Hydrogen bond acceptor 8, hydrogen bond donor 5, log P 3.47. Polar surface area is 133 square angstrom. So this is a small molecule, but it contains several, like 3 chiral centers. They all have SSS stereochemistry. This medication carries a US box warning, fetal toxicity. So therefore the pregnancy is have to be very mindful, and so that related to the fetal toxicity. So therefore typically it's contraindicated right with the pregnancy or the ACE inhibitors, for example, along with the ARBs. Mechanistically, this medication inhibits the ACE. So the ACE, that's the angiotensin converting enzyme. And so therefore block this enzyme. So therefore this would lower the converting of angiotensin 1 to angiotensin 2. And then angiotensin 2 is a very potent vasoconstrictor. So therefore, by blocking this enzyme, the ACE enzyme, so therefore this would decrease the production for angiotensin 2. So therefore, right, in this renin angiotensin aldosterone system, like RAS pathway, so therefore this would decrease the vasoconstriction and decrease the secretion of aldosterone. So therefore, collectively, this would lower the blood pressure. Pharmacokinetics, the bioavailability, so it's around 25%, onset about 1 hour, duration 24 hours, Tmax about 7 hours, half-life 12 hours. Metabolism, so this medication is not really metabolized, so therefore it's no metabolism. Excretion, mostly urine as a parent drug molecule, so therefore have to be mindful for patients if they have impaired renal function, have to adjust the dosing accordingly. Drug-drug interactions for diuretics. Patients, if they take diuretics along with ACE inhibitor, for example, lisinopril, there's excessive decrease in blood pressure. So there are kind of additive effects. NSAIDs, this can increase the risk for renal impairment and have this antihypertensive efficacy. Generally, avoid the renin inhibitor and ARBs in the RAS system. So in general, you don't give together for ACE inhibitor and ARBs. Because this can increase the risk of renal impairments, hypotension, and hyperkalemia. Adverse effects related to hypertension, headache, dizziness, and dry cough, heart failure, hypotension, and chest pain related to acute MI, hypotension. So that's the most common adverse effects related to lisinopril. Amlodipine, the brand name NORVASC. This medication was approved by the US FDA in 1987 and may be used alone or in combination with other antihypertensive and anti-angina agents to treat hypertension and coronary artery disease, for short CAD, such as chronic stable angina, vasospastic angina, and angiographically documented CAD in patients without heart failure or ejection fraction less than 40%. This is a oral kind of long-acting small molecule with 1,4-dihydropyridine motif. If we look at the drug chemistry, so this is a small molecule with this 1,4-dihydropyridine motif. So therefore, this all this class they call dipine have this suffix dipine. So that's the dipine related to dihydropyridine. So for dosing and nutrition for adults, starting 5 mg oral medication once daily, maximum dose 10 mg once daily. Small fragile or elderly patients or patients with hepatic insufficiency may be started on 2.5 mg once daily. For pediatric patient population, starting dose 2.5 to 5 mg once daily. So as mentioned, this small molecule contains dihydropyridine motif, 2 ester, 1 methyl ester, the other side that's the ethyl ester motif, and this contains a primary amine, kind of basic drug molecule. The molecule weight is 408.88 gram per mole. Hydrogen bond acceptor 7, hydrogen bond donor 3, log P 4.16, polar surface area 100 square angstrom. This is a basic drug molecule. It's available as a salt form. In this case, they call basylates. So basically this drug molecule make the salt with the benzene sulfonic acid. So this one make this basylates. Mechanistically, this medication works as a calcium channel blocker. So that's the kind of DHP class, the DPIN, the calcium channel blocker, inhibiting the calcium ion influx across the cell membrane selectively, with a greater effect on vascular smooth muscle cells compared to cardiac muscle cells. So therefore, this DPIN class, the dihydropyridine class, so this is very often referred to 1,4-DHP class. 1,4-DHP, that's the 1,4-dihydropyridine class. And so this class has a greater effect on vascular smooth muscle cells compared to cardiac muscle cells. Because that's right, the 9-DHP, the calcium channel blockers, so mainly targets the cardiac, the muscle cells. So in this case, so therefore this would lower the peripheral vascular resistance. So this would lower the blood pressure. Pharmacokinetically, bioavailability range from 64 to 90% protein binding, 93% Tmax, 6 to 12 hours, half-life 30 to 50 hours, so it's a pretty long half-life for this one, so therefore it's once daily dosing. Metabolism, hepatic, so mainly metabolized in the liver, excretion, urine, 60% as metabolites and 10% as a parent drug molecule. Drug-drug interactions, and when patients, if they take amlodipine, for example, with simvastatin, so make sure do not exceed doses more than 20 milligram daily of simvastatin. So that's another statin agents targeting the HMG-CoA reductase. Contraindications, non-sensitivity to amlodipine. The most common adverse effects, peripheral edema, so that's a dose-related manner, so which means when taking higher doses, so that's the peripheral edema, right? That's dose-related. Over 1%, for example, headache, fatigue, nausea, abdominal pain, somnolence. So this the common adverse effects related to amlodipine. Finally, this is all the key reference which are used to prepare this video. Pretty much all the products prescribing information, most physiochemical properties are from this chemspider.com. Finally, I want to thank you so much for watching. If you enjoyed the video, please consider subscribing for future medication video updates. As always, keep learning and elevating. Thank you so much.